Good. What you're about to see is a demonstration of active isolated stretching. This is Terry, our model and therapist. My name is Rick, and Heather is shooting this homemade film here. And what we're going to start with is a stretch I call the Snow Angel. And the reason that we start with this is just get an overall general feeling of where we feel restricted in the body. So if Terry will just start now by demonstrating, she's going to turn out and slowly bring her arms up overhead, but keeping the arms on the mat for as long as she can. Technically, she should be able to go up over her head without the arms coming off, if everything's nice and loose through the shoulder girdle. That was good. Now we're going to move into a crossover. And Terry's going to show that. Very good. Okay, now the idea here, Heather can just zero in here, is to open up the hip, stretch up through latissimus dorsi and the obliques here. And the way that this should be performed is Terry's going to take a nice deep breath. And then as she exhales, she's going to ask for a little bit more. And then she's going to let all this fascia stretch while she breathes into it. Good. And generally what I recommend is about 3 cycles of breath. Okay. And now she's going to move over to the other side. And again, we'll go through it. She's going to open the hip up. Reach up with the other arm. Good. Good. Very good. Now she's going to slowly bring this leg up, bring the bottom hand down, and very, very, very slowly open up the torso while keeping the knee firmly planted on the mat. She's going to use her breathing here. Good, and generally what you should probably start with the lower fibers on the sternum there. She's doing really good there. Move it up into the mid fibers and then to pec minor there. Using your breathing, do not force it down towards the mat. Let it fall. You're going to let all this tissue just relax. Good. Can you demonstrate that on the other side too, Terry, please? Good. So again, it's bringing it across, opening up the torso. Very good. Breathing's good. Range is good. Good. Now Terry's going to go back into supine. I'm going to start the matties. Now what she's achieved so far is she's loosened up her trunk, she's loosened up her hips, and now we're going to begin the protocol. We're going to start the protocol with what we call like a double pelvic tilt. She's going to bring her legs up like this, her hands in behind the knees, and good. Just slow it down just a little bit so the folks can see that you are using, she's using her hip flexors to bring her pelvis up. And she's only using her hands on the end range with about 6 to 10 ounces of pressure in there. The net effect of this is to lengthen quadratus lumborum, lengthen up through into the hamstrings. Very good. Okay, she's going to come to rest position. Now we're going to employ the strap so that we can get a better stretch on the fascia. And the way I advocate using that is if you can just show here, Heather, strap and then wrap it around this way so you force the foot to externally rotate. Now again, I want you to watch the technique here. Terry's going to use her prime mover to bring it back. 1, 2. Very good. Just a little 1, 2 on the end. That's excellent. Good. Notice how she's not reefing on that strap. It's just a light pull at the end range. Good. 1, 2. Good. Good. 1, 2. Now we're going to demonstrate everything on one side, and then we'll switch over to the other. Okay? Now what she's going to do is she's going to do her rotators on this side. And boots. 1, 2. This is the figure 4. And she's going to walk that leg right across her body. And as she gets closer, she's going to switch hands. Now pay attention here. A lot of people forget about this switch over here. Now this is to get piriformis. She's going to let this leg go out straight and stay in the midline. And she's going to bring that across, trying to maintain the shoulder on the opposite side on the mat. Good. And she's going to... Then from that position, once she's finished that, she's going to move into the IT bend, and she's going to straighten the leg. And then she's going to bring it up using, again, hip flexor, and then she's going to give it a slight pull. While you're doing this, focus on trying to keep this in the midline and straight. Your shoulder, Terry's doing a very good thing here. She's hanging on the mat, so she's not compensating or rolling over too far. And her whole thing is to try to get a little bit lower and higher each time. Good. Now, she's going to go back into supine again. And now we're going to do the lateral and medial hamstrings in a straight leg position. So the first 5 reps, she's going to pull across her body like that for biceps femoris. 1, 2, and 1, 2. And if you just slow it down a little bit, Terry, just so they can see that your knee is totally extended. That's it. Perfect. Good. About 5 reps there. Now she's going to move to the medial out this way. 2, and I'll do about 3 reps right there. Notice how the knee, to get the distal end of the hamstring, has to be extended. Totally. Using your quadricep. Show them. She's contracting this. Good. 1, 2. Now she's going to change the angle out to about 45 degrees. She's going to contract the quadricep and go back. And this is going to give a pull on semitendinosus, semimembranous, which are hamstrings. 1. That's it. A couple more there. Again, she's keeping. And there's another way I'd like to just demonstrate here with your help, Terry, that you can do this, is you can, as you're going down, you can have the knee bent, lock it out, and then bring it up. 1, 2, and so you get full range. Lock it out. 1, 2. You bend the knee coming back and straighten it going up. 1, 2, perfect. Now she's going to move down to her adductors. At this point, this leg is out here. We want you using full range. You're going to just come, click that heel, contract the quad, and very important to contract gluteus minimus medius on this side. And they're doing the work of bringing the leg out, not the strap. 1, 2. And up. 1, 2. Now what you'll notice here is Terry's, what she's going to try to do is to get to a point where she drags that heel right along the ground and it does not leave it. That way you get the ultimate stretch. 1, 2. And she's got good range. That's excellent. 1, 2. That's good there. Now, the last one that she wants to do on this side is for her calf, her gastrocs. So just take the strap. She's going to have the leg out at about 45 degrees. She's going to contract the quadricep, dorsiflex, and then give it a good pull with that. Yeah, both hands. Now plantar flex, and then back. 1, 2. So you feel it pull right into the back of the knee. You get a good pull there, Tara?
Yeah.
Good. Back. 1, 2. Very good. 1, 2. And 1, 2. Good. Now, just take a rest there for a second. We're going to demonstrate the whole thing on the other side, starting with a single pelvic tilt, so that you get to see this again. So she's going to turn out. She's going to use her hip flexor to bring it back, and her hand and the strap to get a good stretch on the proximal hamstring. Very good. Excellent, and I'll stop Terry there. We're gonna slide the leg out now. We're gonna move down the chain, and we're gonna figure four, and she's going to give a good stretch in here to the rotators and glutes. Good. She walks it across. She gets halfway across her body, and she's gonna switch hands. Try to keep that leg straight and bring it across. Good. Walking the knee down towards the mat without rolling over. Good. Now she's going to go into her IT band stretch where the quadricep, again, is contracted. She'll use the hip flexor to bring it up, and then 1, 2 on the end. Perfect. 1, 2. A couple more, Terry, just so they can see your great range. 1, 2. Now she's going to roll over onto her back again. Bring this leg up. And we're going to do the lateral and then move to the medial hamstring. So she's going to have it turned like this. We'll rearrange the strap here. So it's like this. The foot should always be externally rotated. So now she's going to contract, quad, hip flexor, 1, 2. Give us about 3 there, Terry. 1, 2. Good. 1. Now normally I would suggest you do 6 to 10 reps in this position. Good. Now she's going to slide over into her medial. Switch hands with the strap. Contract the quad. 1, 2. 1, 2. Good. 1, 2. Now she's going to move out to 45 degrees and out. 1, 2. 1, 2. That's good. 1, 2. Now she's going to slide this leg down and go into the adductor group. Slide out. 1, 2. Come back and click this heel. Very good. The reason I want full range is I want the antagonist to be working as well, and that's your quad and your glutes. It's a good workout for them. 1, 2. The more you use them, the more stretch you'll get out of your adductors. Good. We've moved all the way down the chain now. We'll finish it off with your gastroc stretch. And turned out, and you're going to plantar flex, and 1, 2. About 45 degrees. 1, 2. Good. 1, 2. Good. And that's everything in the supine position. Now Terry is going to roll over onto her side. This is done in side lying. It's this rectus femoris stretch. She'll show it both sides. Heather's going to catch the order in which we do this. That's perfect. Good. Her leg is slightly, it's up externally, not internally rotated. She's going to tilt her pelvis and at the same time bring her heel to her buttock. Good. 1, 2. And we want a stretch on rectus femoris. 1, 2. The more angle that you apply this, the more stretch. How, does that feel okay there, Terry?
Yep.
Good. 1, 2. Good. Ultimately, you want to be able to take it way out here so you get more length in there. Okay? Terry, you just demonstrated that on the other side now. So we can keep her balanced. Okay, first step is to tip the pelvis and then bring the heel to your body. That's it. Very good. Now Terry's going to go into the prone position, laying on her stomach. Good. And at this point in time, she's going to do the rotators in her hip. Now pay very close attention here. Got her and up. Excellent. Down and up. Down and up. You do 5 or 6 in that position. Then you want to change the angle. You want to bring it across this way and out. 1, 2. So it comes over, touches you. That's it. So that we get all the rotators in there at various angles. 1, 2. You just demonstrated on the other side. That's good range. Excellent. Where you're getting the stretch is right in through the rotators. Good. Happy. That's it. She changes the angle. 1, 2. It's excellent. 1, 2. This will keep the hip replacement away. Good. Very good, Tara. Okay, Tara's going to rest for a second. Now we're going to go into, you can call it the cobra, but we do this segmentally. Terry's first going to lift and stretch the anterior of her neck out. And she's going to pinch the scapulas together and try to lift with her erectors in her back before she uses her hands. To see it again, lift, pinch. 1, 2. Now, lift, and I want to see the scapulas come together. That's it. 1, 2. And each time she's trying to get a little bit higher so she feels it pull right down into the mid-abdomen. The other thing, to stabilize her back, she can pinch her glutes. That's excellent. Good. Now Terry's going to come up into child's pose, which is like on all fours. She's going to give her lats a good stretch. Good. And here again, you're using your breathing. You're not rushing this. You want to feel a good stretch all the way up through here by moving your bottom back towards your heels. The other side. Okay, now that we've stretched the muscles of the lower body, we're going to move into the upper body. Before we can do that, we're going to do the hip flexors, which are in the core. Now, the position that we want to assume here is very, very important. The technique. First of all, the front foot should be well in front of the knee so you don't overload the knee. It should be slightly externally rotated. Now, Terry's body is going to be lined up. It is not going to be pulled out like this. It's going to be dead center. And I really encourage using a mirror because your body will fool you in terms of where you are in space. The back leg, if Heather could zero in on this, the back foot, for a lot of people that are very, very tight, you will not be able to assume this position without falling over right away. So start slightly internally rotated, and as you get better and better, keep changing this foot until, and the reason for that is you want a fascial pull all the way up through here and up into the front. Now, we're going to demonstrate from behind first the line that Terry needs to take. She's going to take her and tip her pelvis up. Good. Now there's wrong ways to do this. A lot of people at first will try to tip their whole body back. You want to just, all you want to move is the pelvis. Good. And now you're going to hold the pelvis there, keep your body at 90 degrees and move forward. As far as your hip flexor in the front, rectus femoris, will allow you. Do not go into extreme pain. Some people will, in the beginning, will only be able to achieve a pelvic tilt. Never mind moving through space. Good, that looks good there, Tara. 1, 2. And Heather should be showing over here the opening of the hip. Now Terry's going to go into phase 2 of this particular. And she's going to take her arms and turn the torso away from the affected area. And the effect there is to get a stretch all the way up through, across the torso, up into the iliopsoas muscle. Good. That's excellent. Now she's going to go into phase 3. She's going to take this leg and she's going to move it up to about 45 degrees. She's going to place her hands on here, and as she tips her pelvis, moves forward, she's going to, that's it, twist the adductor and the quad laterally. And that way she's going to get a very good, can you feel the stretch through those adductors there, Terry? Mm-hmm. The very last stage of this is to move your leg right out, keeping your pelvis a line here. Don't let it follow your leg. It's very difficult at first. She's going to tip again and then move. Excellent. Very good. I want you to really take note how she's tipping that pelvis up and holding it as she goes out. Okay? Very good. Now Terry's going to go back to the original and show the whole thing over on the other side. She's going to bring this leg forward. She's going to align herself. I'll help her a bit here. Good. The back foot is turned out. Good. She's going to tip, come forward. 1, 2. She's a little tighter on this side. 1, 2. And forward, and 1, 2. If you lose your balance, don't worry about it sometime. When I started doing this, I used the coffee table to brace myself because my hip flexors were very short. Terry's doing great. All right, a little bit more. Now what I want her to do is a little bit more twist of the torso as she comes around. So bring them up again and twist. So we get a pull right through here. Excellent. Very good. Now she's going to go out and work on her adductors and quads. Her technique is excellent. Notice how the foot is turned right out. She's still maintaining external rotation on the back, and she's going to walk that right out. Now that leg is at 90 degrees to her body. Very good technique. Excellent. Now Terry is going to go back onto her knees, and we're going to start working up through her torso. Now the next one that you want to do is you want to work on the obliques, okay? So Terry's going to show you how we do that. Now pay close attention. She's rotating the trunk, and again on the end range, just a little 1, 2, so you get a good stretch through the obliques. Good. And the other side, please. About 3 there. Good. Right on the diagonal. She's right on. That's good. Now that we've loosened up the obliques, we're going to move into the pectoral area. And we start with our externally rotated, thumbs up like this, and about that angle. And she's going to, in effect, pinch her shoulder blades together, and a little 1, 2 on the end, with the effect being here is to stretch the pectoral, the pec major fibers on the sternum. And she's going to work her way up the ladder. Now she's going to move up about 20, 30 degrees. Good. Do a few repetitions there. And now she's going to move up into pec minor, which is up there. And into the anterior shoulder. Good. We can just slow it down a little bit there. Keep the arms straighter like you're marching. That's it. Good. Now she's going to move into the rotator cuff. And I'm going to slow her down here because we want to start in what we call a 90-90 here. Okay, she's going to turn. That's what we should be doing. Now rotate. Good. Rotate. Good. Rotate. That's it. Now she's holding her form much better. Good. You have to concentrate on, and again, a mirror really helps. Okay, now she's going to give infraspinatus a good stretch. She's going to bring her arm across her body, reach for her shoulder, and just give it a little hug. Then over to the other side. Good. Now that's infraspinatus, one of the rotator cuff muscles. Not a rotator. Now she's going to do subscapularis, which is a little trickier. And we do this by putting pressure in the back of the hand. And now she's going to rotate away from its origin. Okay, you can turn your head the other way too. Good. So she feels a pull and she keeps the pressure. Good. Can you feel a good pull through there, Terry? Mm-hmm. Good. Good. And as you get better and better, you can take it further over. Good. Excellent. So we've got infraspinatus, subscapularis. Good. Show them on that side. Rotate right out. Yes. Very good. we'll take a little break there, that's excellent. So we have virtually worked from the core all the way through up, done the shoulder girdle, now what we want to do is the neck. Tara's going to put her hands behind and grab her right arm, and now she's going to stretch the scalenes with a lateral, and then she's going to rotate and then extend. And then look back in towards me and lift the chin to get the SCM. And show the other side. Good. So she's going to away from that shoulder. Now she's going to rotate towards me, lift and extend. Good. And then to get the trap and the SCM, she's going to look all the way over there. All of this is done very slowly, very methodically. It's a good stretch in the shower after you've warmed up. Okay, one more time. We're going to go away from me. Good. Rotate, extend, and then to get the SCM and the trap, turn and look right into me. Very, very, very good. For the very last stretch in this protocol, she's going to do her forearms. We do that by supinating. The elbow has to be perfectly straight. She's going to ask the extensors to pull the fingers back as far as they possibly can. Use the other hand and just give a stretch so that we get a pull through here. Very important stretch in today's world with computers. Okay, and you want to try to keep it as supinated as you can. Good. Now notice she's not using this hand to pull it back. She's trying to use the extensors as much as she can to get it back, and then just a gentle 1, 2 on the end. You show the other arm. Straight. Good. Engage the flexors, that's right, and then just a gentle stretch on the end. Good. And there you have it. That's active isolated stretching from top to bottom.